I'm Arslan, one of the third-year internal medicine residents at Henry Ford Hospital. And before I begin, I have no financial relationships with commercial interest to disclose, and my presentation does not include discussion of off-label or investigational use. Now, our abstract is titled Opioid Use Trends After Liver Transplantation and the Factors Which Are Associated with Post-Transplant Opioid Dependence. Dr. Rina Salje was the principal investigator for this study. So the World Health Organization defines opioid dependence as an adaptive state which is associated with withdrawal syndrome upon cessation. And opioid crisis is something which is not just limited here to the United States. It's actually a growing public health burden. And just to give you an idea, in terms of numbers, there was a study conducted in 2010, which I've referenced in the next slide. And per that study, there were 15.5 million people globally who were opioid dependent. Several other studies have also suggested that surgery is a risk factor for chronic opioid use. And there was a study conducted by Clark et al., which estimated that there was a 3% incidence of prolonged opioid use following major elective surgery. Now, liver transplant recipients, which is actually the focus of our study, are commonly prescribed opioids in post-liver transplant settings, which brings me to our objectives. Firstly, to determine predictive factors leading to chronic opioid use in adult post-liver transplant recipients, and to determine trends in opioid use over time post-liver transplant. Our study was a single-center retrospective study conducted at a tertiary care hospital with a high-volume liver transplant program. We included adult liver transplant patients from July 2013 till June 2016, excluded patients with any other major surgery, patients who were victims of any other trauma post-liver transplant, or motor vehicle accident victims as well. With the help of our biostatistician, we use linear logistic regression to predict opioid use in terms of oral morphine equivalents. And then the change over time of opioid use was tested using McNemar's test. Now, these are the results of our study. Just to walk you through this table, as you can see on the extreme left-hand side is the time from liver transplant, and we divide into intervals of 3 months, 6 months, 1 year, and 2 years. As you can see highlighted with the red arrows is the pre-liver transplant opioid use, which was associated with higher odds of post-liver transplant opioid use, with odds ratio ranging from as low as 2.08 at 1 year to as high as 3.57 at 6 months. And all of these values were statistically significant. Next was alcohol dependence was also found to be associated with higher odds of post-liver transplant opioid use. We reviewed the charts of these patients to see how many of them underwent alcohol relapse prevention, and those patients were deemed to have significant alcohol history. Thirdly, the use of psychotropic medications was also associated with higher odds of post-liver transplant opioid use, with odds ratio 2.09 and 2.86 at 1 year and 2 years respectively, and both of them were statistically significant. The way we went about gathering information for psychotropic medication was first we looked at which patients had any psychiatric history, including not limited to history of major depression, history of generalized anxiety, PTSD, or bipolar. And then we tried to see which of these patients were taking medication, including benzodiazepines and antidepressants, and so on for these psychiatric illnesses. Next, some of the factors which are associated with lower odds of post-liver transplant opioid use included adequate family support, which was statistically significant at 3 months and 6 months, with an odds ratio of 0.19 and 0.33 respectively. And the way we deciphered adequate family support was looking at the transplant psychiatrist notes to see if there was adequate family support present or if the support was inadequate. Surprisingly, smoking was also found to be associated with lower odds of post-liver transplant opioid dependence with an odds ratio of 0.89, which is statistically significant. And lastly, female gender was also associated with lower odds with an odds ratio of 0.53, statistically significant at 1 year. Now, this is a graphical representation of the results that I just talked about on the previous slide. Just to highlight some of the most important ones, as you can see, highlighted by the light blue bar is the pre-liver transplant opioid use, which was associated with higher odds at intervals of 3 months, 6 months, 1 year, and 2 years. Next was, as you can see, the green bar is the psychotropic medications, was also associated with higher odds at 1 year and 2 years. Highlighted in the orange bar is the presence of adequate family support, which was associated with the lower odds of post-liver transplant opioid use. This line graph is an illustration with prevalence on the y-axis and time interval on the x-axis, showing, even though it was nice to see the trend of decreased prevalence over time of opioid use post-liver transplant, but it was unfortunate to see still a lot of patients at 3 months and so forth were associated with, still had high prevalence with as high as close to 50% at 3 months and 13.3% at 2 years. In conclusion, some of the factors associated with chronic opioid use that's seen by our study include pre-liver transplant opioid use, concurrent use of psychotropic medications, and history of prior alcohol dependence. Importantly, an adequate support system is associated with lower odds of post-liver transplant opioid dependence. And we need to recognize these patients who are at higher risk of post-liver transplant opioid dependence, as this allows the transplant community to seek out alternate methods of pain management for these patients. Our study did have certain limitations which are universal to any other retrospective design, which include a lack of generalizability, selection bias, as some of the incomplete charts had to be omitted, and the inability to establish a true cause and effect relationship as with any other retrospective design. In future, we need additional studies with larger number of patients, and a meta-analysis which could pool in data from multiple studies could be very beneficial. And we recommend further investigation of alternate pain management strategies, particularly in patients who are higher risk of post-liver transplant opioid dependence. Thank you.